will overwhelm the healthcare system. I asked 3 things. One, on the testing, that, and I'm grateful that he approved the New York testing capacity. FDA has to get out of the way on the automated testing capacity. Let us approve automated testing companies. It can't be 1 or 2 companies are the only companies in the United States doing this. You need hundreds of thousands. Accelerate the testing. Second, the federal government has to provide help and guidance to states on what to do and when to do it. This can't be a national policy of every state does its own thing. You can't have a patchwork quilt of policies. New York State closes stores. Okay, New Jersey doesn't. What did I do? I just sent thousands of vehicles over to New Jersey, flooding New Jersey stores. New Jersey closes stores, and I don't. What did they do? They just sent thousands of New Jersey people to shop in New York and then go back to New Jersey. You cannot do this ad hoc, one state at a time. Make a decision, tell the states, this is the decision, and then let's go. Closing schools. If you think schools have to be closed, well then help us. Where do we get the child care? Where do we get the meals? Where do we get the money to provide the meals? There are ways to do it. We could just increase what's called the SNAP program, the food assistance program to a family, and say, you know what? Your food assistance payment is going to go up 50%. You buy Johnny breakfast and lunch. But we have the federal government that is integrally involved in that. Help us plan and help us coordinate, and don't pit one state against the other inadvertently by having them come up with different policies. That's the second point. The third point is this. You're going to need more hospital capacity. You're going to need more facilities. You're going to need ways to free up those 53,000 beds. You're going to need to construct or retrofit physical buildings, acquire thousands of pieces of equipment like this. The state can't do that. I don't have that workforce. I don't have the resources, but even if I had the resources, I don't have the physical capacity to turn SUNY dorms into hospitals in 3 weeks. I can't. There's only one workforce that can do that. It's the Army Corps of Engineers and the military assets. That's what they do. They build bridges, they build camps, they have tens of thousands of personnel, trucks, equipment, excavators, logistical managers, purchasing power. Use them to come in right now, identify existing facilities that can be retrofitted, and use them to do it. China built dozens of hospitals in literally like a month. How? The Chinese government came in and said, we're going to do this, we're going to nationalize it. South Korea, the same thing. You can't leave it to the states. I can't do it. I do not have the resources or the capacity. And by the way, I'm an aggressive governor. I push very hard. But there's no way that we could manage this undertaking. The Army Corps of Engineers, I used to be in the federal government. I've worked with them. They're amazing. Their capacity is amazing. And what better time to use those resources than saying, let's get to work, let's retrofit buildings, let's purchase the equipment, yes, let's use that massive logistical machine of the military to actually save lives. It makes all the sense in the world, and by the way, we have no option. We have no options. You know what management is? Pick the best option. My expression to my colleagues, what are my options? Well, you have none. There's only one. Okay, I pick that option. You have no other option. Otherwise, we will be sitting here 9 weeks, 10 weeks, 14 weeks from today, seeing a healthcare system overrun. We will be saying, we knew this was going to happen. Why didn't we provide more health care facilities? Why didn't we do everything we could to make that a reality? Doing everything you can to make that a reality means bringing in that Army Corps of Engineers and that military expertise. And I hope the President takes me up on it. With that, questions, comments, any points I left out to my colleagues here?
One other thing that we're starting tomorrow is the DMV is going to be moving to appointment only so that we keep crowds out of the DMV. You can do that online, or if you don't have access online, you can go to the DMV, make an appointment, and then come back.
So, Governor, based on everything you just said, does it make sense to bring the legislature back here this week with their staff, hundreds of people at the Capitol, when you're saying even businesses should possibly close or work from home?
Government is an essential operation to manage this situation. To me, that's like saying, in a war, when people might get killed at war, does it make sense to send soldiers?
But do they have to physically be here this week? I mean, there's other things you could do. Close the Capitol for a couple of weeks.
Karen, there's no couple of weeks here. There's no couple of weeks.
Should you do a budget extender till, say, June? You've said that you don't know what the state's finances are.
Look, should the Congress not show up? Should the military not show up? Should the police officers not show up? You're asking nurses to show up and do their duty. You're asking nurses at these drive-through testing facilities like in New Rochelle, show up and do your duty, which is to help the public health and put on a hazmat suit and take blood. If we can ask nurses to put on a hazmat suit and take blood, we can ask elected officials to come sit at a desk and vote on a piece of legislation.
Governor, there's a difference between healthcare professionals and lawmakers. I mean, up until last week, we were all here, we covered the legislature. There was no social distancing implemented whatsoever. So how is this week going to be any
They should
different?
take all the precautions. But Bernadette, I need them to authorize the laws and the measures that we may need to do this. You need soldiers to fight the war. Government must function because government is doing all of this. Government goes home, none of this happens.
Governor, do you feel New York City should be shut down? There's growing calls to have bars, restaurants, gyms, et cetera, closed mandatorily. How do you feel about that?
Well, when you say New York City shut down, are you talking schools, businesses, or streets?
I'm talking entertainment, social gathering spots, bars, restaurants.
All right, because there are gradations, Jesse. We started gathering places, et cetera. So we have started that.
Yeah, but there were reports everywhere last night that bars were full, restaurants were full, people weren't abiding by the reduction.
Well, then they're violating the law if they're doing that, and then the NYPD should come in and shut them down, right? Now, if your question is, should we get more aggressive in the shutdowns? That's something we're looking at. And you look at those numbers every day, and there's a knob, and you turn the knob, higher or lower, depending on what you see. If